I'm Bevy Smith, and I'm here with Soledad O'Brien, here to disrupt and dismantle the cost of Black motherhood in Mississippi, one of the highest rates of infant mortality in America.
It is absolutely shocking. And America itself has a very high rate of maternal mortality, which is insane when you think about how advanced, medically speaking. The high cost is borne by these mothers who sometimes lose their lives, lose their children in childbirth because they're not getting the health care that they need. But also, the cost is not high at all if you actually would fund them. If in fact they were able to pay for it. I think the number we came up with in our research is about $800.
It's so funny to me whenever we kind of look at other places and say, well, America, no. But it really is happening to Black and brown people specifically.
Whether women are women in poverty and they're Black, or they're college-educated women and they're Black, if they are in childbirth, they're at risk, at really high risk. And some of that is due to stress and some of that is due to bias.
Exactly, because they also saw that if we have Black doctors, we have a much higher chance of surviving childbirth.
And there's lots of mythologies, right, around women and their health. I mean, there's a mythology that women don't need as much pain medication because they don't feel pain.
New York City, we just recently, I think last year, tore down the statue of the man who was once called the father of modern day gynecology, because he was a man who operated on slaves with no anesthesia.
Right.
He was practicing on them so that he could do it correctly on white women.
The theory was that Black women don't feel pain, which is insane, but mythology like that actually makes its way into medicine. And so you see in these really different outcomes for women of color when it comes to childbirth, when it comes to infant mortality, and when it comes to surviving childbirth. It's really disturbing. And so I think that there are many holistic approaches to how to fix this problem. Some of them involve money, but some of them involve just awareness on how you can treat your patients better.
We have to actually make sure that women and their partners have to be able to advocate. And that brings us to the question of the fourth trimester.
I mean, I hate hearing about a fourth trimester because I always think the third trimester is sort of miserable. But I do think this idea of focusing on after the baby is born is a really crucial time. This big difference in how Black women and white women do in childbirth and in infant mortality, those numbers are disturbing, but they could be fixed.
Back in the day, we had midwives, and now we have doulas. And I think that that's something that we need to be advocating for more often.
Yeah, and one of the things that we're seeing is a number of people are returning to the doula model, right? Especially in Black communities, where they're saying, we need to make sure that we can be there for an intervention. There's an amazing program in New Orleans where they're very specifically trying to make sure that women are able to survive childbirth and that infants are able to survive. So it's very tactical, very tangible, very specific, because they know they can be helpful.
Yeah, which is insane that you even have to have a program like that.
Any programs that help women, like Save Ourselves, right? And help them advocate for themselves, understand the questions to ask, and also understand how to approach doctors who they feel might not be listening to them, or also might be believing some of these myths about you don't need pain medication, and actually, we can kind of ignore your complaints. Advocating for yourself is most important.
Crucial. The work that P&G is doing with BT, the Saving Ourselves initiative, is so crucial. We need advocates and we need allies in our community. We should be really looking towards the brands that we support, make sure they support us.
At the end of the day, I think the only thing you can do is try to figure out who are the allies and bring them together. There are some people who are willing to be conveners, right? Conveners of a real, honest discussion about something that's difficult. These problems do seem big, and they seem like they've been going on for literally decades, and in some cases they have, but they are fixable. I think we're seeing real change across the board.
Yeah, definitely.
Learn more about how P&G is stepping up to make lasting systemic changes to positively impact our communities and how you can help.